Hi, this is our grade presentation for Clinical Inquiry 3. We're going to be reviewing two systematic reviews that looked at thoracic outlet syndrome and treatments. And just in case you weren't familiar, I'm Riley, and we also have Sasha and Hannah presenting. The first systematic review that we looked at is entitled Systematic Review, the Effectiveness of Physical Treatments on Thoracic Outlet Syndrome in Reducing Clinical Symptoms.
So the clinical question for this systematic review wasn't exactly clear. So the researchers had clearly stated that there is no clear definition of the protocol within conservative treatments. Therefore, this review concentrates more on physical treatments such as passive mobilization, manipulation, massage exercise, hot and cold therapy, electrophysical modalities, chiropractic treatment, osteopathic treatments, and strapping and taping.
The author's aim was for this review was to look at recent evidence and see if there was effective treatment for treating thoracic outlet syndrome. And so that was the purpose.
So this is just a flow chart showing the search strategy that the authors used when they were getting their articles. As you can see, they used a lot of databases, including Medline, CINAHL, BASE, Pedro, PubMed, and Google Scholar. They originally had 4,490 articles, which they narrowed down until they got down to about 18, and then 7 of those were excluded after reviewing because there wasn't relevant information or there wasn't a validated diagnosis proving thoracic outlet syndrome, or they just weren't able to access the full text. So then it got brought down to 11 articles, and they showed that 2 of those articles showed significant improvement with thoracic outlet syndrome by physical treatments, and 4 case studies reported clients with thoracic outlet syndrome being able to have pain relief and fewer symptoms with physical treatments.
With the
So the methodology that followed up from that, there were the filters that were included, and they were broken down into 2 categories. It was based off of words related to TOS, as well as the types of intervention. So with that, they had thoracic outlet syndrome, Ayperter syndrome, and a slew of other words related to TOS. And then for the types of intervention, they included, excuse me, the sneeze. They included types of intervention, including physiotherapy, physical therapy, conservative treatment, rehabilitation, management, non-operative exercise, etc. From there, they had pros and cons. The pros that were included is that they were able to use multiple search terms and then combine them to create new search terms. And as Riley had also mentioned, they had multiple electronic bases utilized. And then some of the cons that were considered from these filters is that the data was collected as far back from 1990 to 2009, so it is relatively older data. They only selected English written research, and this also gave lack to literature that was regarding experimental studies. And only 2 out of the 11 articles showed significant difference of the interventions that were utilized, and also most of the statistical tests that were used were unfavorable.
Sorry, some technical difficulties unmuting myself. The AMSTAR for this article was there was a research question. There were multiple people looking at the study to extract data. There was a comprehensive literature review. They used multiple databases. They did have inclusion and exclusion criteria of why they added and had certain studies versus others. There was a list of studies provided, and there was a table about each study with data about the study. The scientific quality of the study was included. They included randomized control trials, clinical case studies, things like that. The scientific quality of the studies were included. So they talked about whether it was a case study or a randomized control trial. The methods for using, what were the methods used to combine the findings of the studies appropriate? They did not do any kind of assessment for homogeneity, so that was a no. The likelihood of bias was not assessed, so they did not discuss anything about bias. So there's a no, and then the conflict of interest was not stated as well, so that is also a no. Therefore, we graded this as an 8 out of 11 for the AmStar.
So using the grade assessment, we rated this as low because there was a high risk of bias, seeing as there was no discussion of preventing any bias. There was no imprecision, seeing as there was no statistical analysis performed, and there was no inconsistency, again, because no statistical analysis for heterogeneity was performed. There was high indirectness, seeing as they used randomized control trials, case reports, prospective studies, and case studies. There was a lot of variety there. And there was high publication bias because of the poor quality of evidence and because of the grade that we gave this using our AmStar of an 8 out of 11.
So for our second systematic review, the title of it was Treatment for Thoracic Outlet Syndrome.
The clinical question that the authors looked at was, they undertook this review because of the complex nature of thoracic outlet syndrome, because of the pain and chronic morbidity that affects the people with this condition, and limited data available to guide treatment decisions. The authors plan to investigate each type of TOS independently if evidence was available.
The purpose, as stated in the paper, was to evaluate the benefits and the adverse effects of the available operative and non-operative interventions for the treatment of thoracic outlet syndrome a minimum of 6 months after the interventions.
So going into the methodology for this review, on the right-hand side, you can see the breakdown of how they selected their articles and how they were extracted thereafter. Their filters included thoracic outlet syndrome, costoclavicular syndrome, scalenus anticus syndrome, superior thoracic aperture syndrome, and cervical rib syndrome. They also strictly included a collection of randomized controlled trials as well as quasi-randomized controlled trials. With that, they had pros and cons of these filters. Some of the pros included the fact that they used multiple search items and databases. There were 3 independent reviewers that they had used, and they had actually specifically been assigned extracting and including the data, as well as the cons that may be against that is that they only selected articles that were written in English, and their data research went as far back as 1937.
So the AmStar for this article, a research question was provided. There were multiple reviewers for each study. There was a comprehensive literature research performed. Multiple databases were again used. The publication status was included. So that was a yes. There was a list of studies that were both included and excluded from the study, as well as a table that provided data about each study. And the scientific quality of each study was included, and they only include randomized controlled trials or quasi-randomized controlled trials. The scientific quality of each study was used to formulate the conclusion, and the methods for combining studies was used, and the likelihood of bias was assessed, as well as any conflict of interest stated. So we said yes for 11 out of the 11 criteria. Therefore, we gave this a high quality study.
So we gave this a grade of moderate because there was a low risk of bias, seeing as they used randomized control trials and quasi-randomized control trials, in addition to having multiple reviewers in order to reduce the risk of bias. There was no imprecision because there was no statistical analysis performed. There was no inconsistency, again, because no statistical analysis for heterogeneity was performed. Indirectness was moderate because there was a lack of consensus for diagnostic criteria of thoracic outlet syndrome, and there was also moderate evidence to suggest the use of Botox on the scalene. And finally, publication bias was low because there was no bias reported. They used randomized control trials, and there was an unbiased review process, in addition to high quality evidence. And as Sasha had mentioned, we had an AmStar that we scored an 11 out of 11, which is pretty darn good.
These are our references for the 2 articles for the systematic reviews. Thank you very much.